Hi everyone, and welcome to our next instalment in this month's focus on innovation in rural allied health. Today I'm joined by Chris Mitchell, CEO, and Sarah Venn, Health Workforce and Service Planning Manager of Health Workforce Queensland, a not-for-profit rural health workforce agency that creates sustainable health workforce solutions. Today, Chris and Sarah are going to tell us the story behind the recently released North West Queensland Interagency Allied Health Workforce Strategy and identify their top strategies for the next 2 years to enhance allied health workforce development in health services in North West Queensland. But firstly to Chris, can you tell me a bit about Health Workforce Queensland and your current involvement in allied health workforce development?
Thanks, Kat. Thanks for the opportunity today too. As you said, we're a not-for-profit rural workforce agency, and we're focusing on making sure that remote and rural and Aboriginal and Torres Strait Islander communities, particularly in Queensland, have access to highly skilled professionals when, where, and where they need them now and also into the future. So we do this by creating sustainable health workforce solutions to meet those needs. So you've got to understand the needs to start, and then you work through a number of processes to identify, then try and work through and implement those long-lasting and hopefully sustainable solutions. We've got relationships with the workforce in the communities. We've got relationship with the health service providers in those communities as well. There's a range of other stakeholders who are beyond the community that we collaborate with in the various organisations, including SARRAH and others, who have a particular interest in that either profession or that location. So we've been delivering integrated health workforce solutions to Queensland communities since 1998, and we're continually adapting them as we go along. We've been actively involved in allied health recruitment and support since about 2012, but in our modelling prior to that, it was very obvious that something needed to happen in the allied health space and more support was required. I'm pleased to state that there's a larger number of allied health professionals in the rural communities for a whole number of reasons, and mostly some of that is about federal government funding to get programs supported in certain ways. So that's awesome. A number of things we do as a workforce agency is, and particularly probably one of the most important ones, is we do an annual statewide all health workforce needs assessment, particularly for rural and remote Queensland. We collaborate with the primary healthcare networks and we collaborate with the jurisdictional health to make sure we've got those. And there's also an outreach provider in our state, which isn't the workforce agency. We collaborate with planning, make sure we've got our efforts are pointed in the right direction. And we have a very active health workforce stakeholder group. We also have maintained a database on health professionals for many years. Most recently, it's focused on M 2 to 7. The growing number of allied health professionals, I've been around for a little while, and that number's grown and grown and grown, and counting has improved as we go, but we still haven't tracked everyone down correctly across Australia, as you know, as well. So we're looking forward to getting that solved one day with yourself and others. So we also provide recruitment services to permanent and permanent general practice, nurses and allied health in primary health care. We do have locum services for general practice, and not so extensive in the allied health and nursing component for the locums. We also provide relocation support services for those that are being recruited. We have a number of retention strategies as well. And we also have a case management approach. So we're trying to work with the individuals. We deliver CPD workshops as well. And most recently, last couple of years, we've been able to provide scholarships and bursary arrangements for rural and remote allied health. We have great interest in that and great uptake in that for professional development and also to undertake further studies. So it's really important that we're able to, among other people, bring that together. The two final things are rural immersion. We find that to be really important at student level, and we do that right across all the professions. We have expertise in research methods, particularly focused on the workforce and service planning.
Fantastic. So some excellent work going on there. Thanks, Chris. And I guess my next question would be to both of you. What is it that most excites you about this work?
Well, I'm excited and have been and quite passionate about rural workforce for 20 years, and we've been working hard to do that. Every day is different and every situation is different, but there are some core themes that we know, and we've thought about things as we've gone quite deeply about what impacts and what makes a difference. So we're finding at the student level that rural immersion is really important, prior to that, it's obviously interest in career at prior to high school level and then through to high school, but rural immersion is really important. Sustainable workplace training is really important as well. And along with that is professional supervision, which hopefully we'll get some time to talk about today. That professional supervision support is super important. And included in and connected to that is the networking and other supports. But really excited to be able to talk about one of those programs in a minute with Sarah about how we can address some of those. And the other thing is what we're looking at and the information we've got is we've got a relatively inexperienced workforce. And I think this is a bit of a theme that folks come out to the bush that they're not overly experienced, but they're really good because they get a lot of really good experience straight up. But I think the point is we make sure that support is done well. The cost and service impacts of the turnover, though, is not useful. It does, the vacancy costs and all of those things impacts on the sustainability of both private as well as the public allied health services as well. And I might get Sarah to share some examples of some of those strategies that we have.
Sure, thanks, Chris. Thanks, Kath. Yeah, so in regards to rural immersion, we do have a Grow Rural workshop, which is actually a 3-year rural immersion program, providing medical, nursing and allied health students with an annual opportunity to experience comprehensive clinical practice. Grow Rural really fosters that development of rural networks, friendships, and allows students to experience, I guess, the unique lifestyle of rural and remote communities. And it's a great way to at least get people to dip their toe in the water. And of course, examples of good interprofessional supervision, networking and other supports is of course the example of the Northwest Allied Health Interagency Workforce Strategy that we've co-designed, and it's co-funded by the Allied Health Professions Office of Queensland and Queensland Health. And that's really with the aim of working with stakeholders to form an interagency collaborative regional approach to allied health workforce development, really to aid in the recruitment, retention and capacity building of health services, well, in this instance in the northwest of Queensland. And we really find, we're hoping that this model is a really good model that could be potentially replicated elsewhere to try and support that kind of strategy.
Oh, fantastic. Thank you, Sarah. So, Sarah, just building on that, can you go into a little bit more detail for us just about the story behind the Northwest Queensland Interagency Workforce Strategy and the top strategies that are suggested in the proposal?
Sure. Yeah. So, just to let everyone know, it is on our website as well, so you can find further detail as you go along. But the project really emerged from discussions in November 2019 when allied health service providers and commissioners in Northwest Queensland met at Mount Isa to discuss basically the challenges and opportunities for workforce sustainability in their region. Mount Isa has a number of organisations with cohorts of allied health service providers, including Northwest Remote Health, Gidgee Healing, Northwest HHS, the Centre for Rural and Remote Health in Mount Isa, and Education Queensland also had allied health as well as other private providers. And this really made it a great region to explore an interagency model. And other supporting organisations included Western Queensland PHN, of course us as Health Workforce Queensland, and the Allied Health Professions Office of Queensland. So we all came together and it was really identified that there was a great opportunity to grow our own as well as collaborate and pool resources and strengths of organisations to leverage capacity and sustainability. And so out of that meeting came a 4-month scoping project. We were lucky enough to nab Robin Adams to take on the project manager role, who has got a great background in understanding rural and remote allied health as a clinician, as a researcher. And we were also able to get Ella Dunsford from the Centre of Rural and Remote Health, combined as a half-time project role to be able to undertake this scoping project. And that the objectives of that project really were to build an allied health workforce to provide accessible, appropriate, sustainable allied health services, to develop the staffing profile, to include well-supported early career professionals, developing clinicians and experienced leaders. So all the way through, develop that own grown workforce model, and examine that remote practice and remote allied health careers were greater than just the provision of clinical services, that there is more to it and there can be more to it, which makes it really more exciting and might make people want to stay. So we use the allied health rural generalist model as a kind of a central structure in which to achieve some of these objectives. What some of the key findings that really told us that the allied health rural generalist pathway is an accepted structure for workforce development in primary care and in the public health sector. So, and that an interagency collaborative approach to supporting early career health professionals may mitigate risks associated with vacancies for senior roles and provide a breadth of training and supervision resources that individual organisations could not source independently. And that your local university Department of Rural Health, the Centre for Rural and Remote Health, are really well placed to support a cohort of early career rural generalist trainees with education, expertise and infrastructure to support sort of that group training. And so I guess I'm not sure, the 4-month scoping project was completed and we're going into the implementation now, and that implementation plan is up on the website. And steps that we've taken from there has basically, we've formed an interagency implementation oversight committee with 2 co-chairs at the local level. It's been endorsed, it's signed up by all participating members, and there are now 9 allied health rural generalist training positions across 3 organisations. We have a learning facilitator in place and a learning facilitation group formed, and there will be training cohort development days commencing. Well, I think they've actually just commenced their first one. So action is happening in Mount Isa and further afield. All those services obviously go much further than just Mount Isa. So I guess what we were trying to achieve was collaboration to leverage and enhance and sustain. So I think we're on the right steps and pathway, Kath.
Fantastic, Sarah. We'll certainly be watching that project very closely, and there'll be some fantastic learnings coming out from that over the next couple of years. I'm just curious to know, in the Commonwealth Government's October budget, we saw an announcement aimed at strengthening primary health care to address rural workforce shortages, bringing together local health networks, state government health districts and local health leaders to test new models that will inform options for wider primary health care reforms across rural Australia. Based on your involvement in the North West Queensland Interagency Allied Health Workforce Strategy to date, what advice would you have for implementation sites to ensure that allied health workforce needs are addressed?
Good question, Kath. I can take this on, Chris. So basically, I think any new models or models that need that can be expanded up really need to have first and foremostly a willing and interested collective with a common goal. You go with the willing, and certainly there are many places with need, but there has to be a spirit from community and from the providers to have a willingness to move forward. I think that's number one. Collaboration, of course, is the big word, but there's lots of elements to that collaboration, including shared positions, both public and private, and a reduction in that red tape for this to occur, such as credentialing and so forth. Shared supervision models, innovative super models, remote supervision models, potential opportunities for rotations between settings, public and private, for orientation and graduate years, to really get people a feel of the communities they're entering. Interprofessional training opportunities, such as the interagency approach we've used with the Allied Health Rural Generalist pathway, and that key and important networking socially and professionally for opportunities to reduce isolation. Funding wise, I think we need to just call out the white elephant in the room with the pay disparities between public and private settings and how that could be addressed with models. Bundling incentives, you know, to boost recruitment packages to so primary care providers can be more attractive to pull in new workforce. Commissioning models that enable workforce development and sustainability strategies for remote teams. They're really critical for primary care services, and the PHN commissioning models maybe could be looking at something that enables more than just clinical service delivery. Blended funding models to support service models across regions, and obviously blended planning to start that process. Importantly, use of technology to enhance workforce and service models. We know that telehealth has exponentially grown, and that can be very useful in developing service models. And most importantly, administrative support from non-clinical organisations to progress projects and working groups to ensure projects keep progressing. What we find often is one of the killers is time to be able to take these projects on, and it really does require strong administration support, and that's funded too, because often there's no money in the budgets for actually implementing some of these projects and the time-consuming nature of workforce working groups and so forth. So they're the ones that really spring to mind straight off the bat. But I'm happy to take advice from you, Kath, if you've got some more ideas as well.
Oh,
Kath, I wouldn't mind adding one to that too,
yes.
Kath. Just that issue of the disparity or the parity issues. We didn't address that front on because we've been there before, and you're using your energy in the wrong space. This is about collaboration and how we look after the cohort and support them. And that's totally possible within the current resources. But as Sarah said, the first point is a willing spirit and a collaborative arrangement. And to an organisation, their leaders went, yes, this is what we want to do, because they could see the benefit. So that's super important. And some of those finer things can get worked out as we go along. But it's really useful to have, well, what are those things that we've learned along the way? So thanks.
Great, thank you, Chris, and thanks, Sarah. Look, there's I think you've summed up those important points really well, so I don't think I have anything to further to add at this point. You know, we will be watching your project with keen interest over the next couple of years, and we hope that the information that you've been able to provide us today goes some way to inform some of those primary healthcare innovations projects that we'll see rolling out over the next year or two. So look, thank you very much for your time this afternoon, Sarah and Chris. Really appreciate it, and have a happy Christmas, everybody.
Thanks,
Thank
Kath.
you, Kath. Thank you. Bye-bye.
Merry Christmas. Bye.